A very good afternoon to the esteemed faculty present in the audience as well as on the dais. I'm Dr. Talvir Sidhu. I am going to present a case presentation, a very short case presentation on normal tension glaucoma. Although in my personal patients, I did not have a very long follow-up of a normal tension glaucoma, although I'm following up quite a few number of normal tension. This was a case that was published in AIOS the guidelines that were taken out for open angle glaucoma 2-3 years back. So this case was of a 40-year-old female who had a history of headache, and the intraocular pressures, while they were in a very normal range, the optic discs, as we can see here, were had RNFL defects in the superior and in the inferior quadrants, both in both the eyes, with a disc hemorrhage that is present in the left eye. And the visual fields, they were as such, as shown here in the right eye. There was a inferior arcuate scotoma and a nasal step in the left eye, which was almost about to become an arcuate. So diagnosis is usually very obvious in normal tension glaucomas, and visual fields when they present are very close to the fixation and quite inside the germs area as they present. And the management, as has been already described, that 30% of intraocular pressure reduction has been suggested by the collaborative normal tension glaucoma study. And the target IOP that was actually thought about in this patient was around 10 to 12 millimeter of mercury. And for that, the patient was prescribed latanoprost in both the eyes. And after 4 weeks, the IOP was found to be 12 to 14. In a long-term follow-up, it was found that the person, this patient did not progress in the right eye, while in the left eye, there was likely progression in 3 or 4 points as shown in the picture below. And we can see that there are shaded triangles that are present quite near to the fixation, which were not present in the initial visual fields of the patient. And these are also just like in the normal tension glaucomas, very typical close to fixation visual field defects are present. The intraocular pressure in long term was found to be 12 to 14 and 12 to 16, while the patient was also under treatment for migraine, and the patient was actually this lady had migraine. So this is a case presentation. I have actually left very many open-ended questions in this case report, which can be addressed in the discussion, that how these people, how the patients with normal tension glaucoma, they can progress, and a very good follow-up in normal tension glaucoma patients is needed. Thank you very much.